I've kind of had psoriasis since I was 14. I didn't know it was psoriasis though. I've had eczema my whole life. And if you know anything about having eczema and psoriasis, it's super rare. It's like 2% of the population. Then if you factor in, Rabbit, I see you. I feel like you know what I'm talking about. But but then if you factor in like being Black, it's like a whole other thing, because what does eczema look like on Black skin? What does psoriasis look like on Black skin? The average dermatologist, at least the ones I had been to, had no idea. At least the dermatologists that I had been to had no idea what these conditions looked like on Black skin. And so anyway, I started with the dermatologist, and it was kind of like, no, I think that's eczema. I was like, oh, okay. I don't know. And it took me a while to find a Black dermatologist, but when I finally did, I like went in, and I went in with a hypothesis. I was like, hey, listen, like, yes, I have eczema, but I don't think that's what this is. I think this is psoriasis. And she took like one look at my skin, and she was like, you should be a dermatologist. Like, that is absolutely what that is. Like, I don't even like, it was so clear to her, and she'd seen so many Black patients and just knew what it looked like. And so that was kind of like the first piece of unraveling, like, what were all the other things. I was like so intent on doing research and like kind of coming in with, hey, can we rule this out? Like, hey, have you checked this? That is the only reason why I was able to get a diagnosis like in a year, whereas I know like some people have to wait like years and years and years and years before they actually get a diagnosis, because like maybe they don't have time, like maybe they don't have the capacity to do that kind of research, maybe they don't have health insurance. So anyway, there's like all these different like issues that come into play.
Well, for psoriasis, I had it since I was 5 or 6 years old, and I was covered from head to toe. But we grew up dirt poor, so my parents never took me to a doctor. I didn't actually go to see my doctor, which is as I tell the story, like, it gets more embarrassing at times. But on my first day of school, the school would not let me come to school because I was covered from head to toe and these scales all over my body. So they actually took me to a hospital, and that's when I started getting my first treatments for psoriasis. The psoriatic arthritis part, I started having symptoms. I was probably about 25 years old, and I would have stiffness in my hands, my joints. When I got up in the morning, I couldn't get up and walk, fatigue, the swelling, just the whole 9 yards.
I just remembering it being really itchy, and I was very confused because prior to psoriasis, I never had any skin issues, even acne. So I was just like, what is this? And I left it because I was just confused. Like, it was itchy, it was painful, but I just left it because I thought, oh, it'll go away, because it's very common within amongst like South Asian communities, like to be like, oh, just take a paracetamol, the pain will go away, or just like, or just wait it out, that kind of attitude. So I kind of just left it because I thought, oh, okay. But then it started to spread across the rest of my face, and then patches on my body, and I was like, oh, this is not right. And my mum noticed as well, and we had a discussion about it, and she took me to the GP, and ironically, my GP is actually a dermatologist herself. She's a qualified dermatologist, but she couldn't even, and she's white as well, and she wasn't even able to diagnose psoriasis on my skin, despite her being a dermatologist. So it was, and I remember her getting the book out and like just looking through the pages, like, what's this on your skin? But with my arthritis, I've had a more positive experience with that, because when I went to the doctors for my arthritis, when I had the symptoms, I straight away went, I said, listen, I think this might be psoriatic arthritis because I have psoriasis, because it's in my ankle. And I was not taking no for an answer. I was like, you will refer me to a room, please. And they were like, yes. So, and I was referred to a rheumatologist. And that's it, really. I straight away knew this was psoriatic arthritis. I just knew. I think you just know, don't you, sometimes? So yeah, that's my story.
So for a while I was a massage therapist in New York State, and when I was going through schooling, I and the one other Black person in the class would routinely have to tell everyone there, including our teachers, including the profs, like, this is not what this is going to look like. Like, you're explaining skin things to people who are first responders, who see skin first, who are interacting with people's skin, and you are teaching us to look for redness, hints of redness. Like, it's just not gonna look like that. It's just not. It was never gonna look like that on us. And on one hand, it's like exhilarating to get to be somebody in a position to tell a room full of fledgling therapists, like, hey, this is what it's going to look like. That part feels great. And then you remember how many other fledgling therapists there are, and how many professors how many years this school has been in existence, and how many classes this professor has already taught. And I'm the first person to tell you this is concerning. So from that aspect, I think the thing that I would want people to take from that is that it's really important and like useful to pass through the barrier of shyness.
My psoriasis was spreading. I used to just be on my extremities, but I remember at one of the appointments, I had it all over my torso as well. And then she started asking me other questions, along the psoriatic arthritis path, which is, do you have any joint pain? And, what's funny is back then I wasn't connecting, the two. I was like, I couldn't get up when I was gardening. I can't pick up my kid. Do I have any joint pain? Because I didn't connect those things with joint pain. But I realize now that it was my hip pain. So it was joint pain, but it's like you tend not to think about your hip as a joint, but it is. It's like the biggest joint in your body.
All of our psoriasis doesn't look the same. Most textbooks, when you read them, they when they mention psoriasis, they said red with white flakes. I've never had a white flake on me in my life. My psoriasis is was a dark purplish color. I know from what I do going to underserved neighborhoods, I do know that we have limited medical research out there. We have limited education. Not to mention the Black communities, they don't even have clinical studies, which is really, really bad. So unfortunately, if we're not getting the studies, if we're uneducated, and also don't forget the lack of trust. But the point I'm trying to make is, because we don't get all this stuff, so now we're going to have lack of data. We're going to have barriers that's going to come up. Even care because the people don't see people of color with psoriasis. If you're dark skinned, number one, like I said, we get diagnosed the most, because they're going to think that because they haven't seen our skin, that it's something totally different. And it makes it hard for the healthcare provider to identify and give us the right diagnosis of what we have.
I was taught to be submissive to older white men, consciously or unconsciously. I know that when I'd go into these doctors' offices, my shoulders would curl in, I'd be timid, head down, and I'd be thinking like I couldn't communicate with them. I don't know what was going on, 14 years old, 16 years old, 18 years old, like terrified. And then I just stopped going for treatment and going to the dermatologist altogether, because after seeing a variety of the same kind of dermatologist, I was done with it. And so I just let my skin flare. I relied on other things to help me, to numb out, to just forget. However, through a contract I got to meet a South Asian dermatologist who is the same age as me. And I received treatment because she sat and listened to me. And so when I met a South Asian doctor and she listened to me, I was much more open to receiving treatment. And I'm now in a place that I, am in remission for the first time in, most of my life, I can say. It's been a long time. And because she listened to me and she understood. But if I was talking to the younger person I was, and the person who was scared, very intimidated, I would teach myself to start documenting everything, which was also mentioned, every symptom, not just what I'm experiencing in the moment, but actually documenting all my symptoms, doing my research online, talking to other people, asking for what I need. I would actually be an equal seat at the table, and I would say, this person is here to help me, and I'm also here to help myself. And so it's about learning how to be empowered. And if you need to bring a support person in with you, or someone to hold your hand or to talk through it with you, now that I've found provider who understands, who cares, who understands the issues that we as BIPOC people face. She talks about it all the time. She consults on this. She talks to other doctors of all backgrounds, and especially many, many folks who are women, right? And in the field, and they want to support and help us. And that is, for me, I get really revved up and excited because it's totally changed my life getting a practitioner and a person who understands.
Like for me, I had no idea how the medical system worked. I had no idea how to like talk to a doctor. I didn't realize that like going into a doctor, it wasn't like it's in so many ways, it's not like a conversation like just around your care. It has all of these kind of like layered dynamics. And in so many ways, it's like a job interview. Like you need to be able to like quantify your symptoms and your pain and all of those things. And so like one of the things that I would say to like doctors is that I feel like it's so important to like recognize like the level of anxiety that like BIPOC communities are coming into the office with, and to like do everything in your power to like create an environment that is safe and that is like somewhere where like someone can talk easily and freely and not feel like they're going to be judged or dismissed or like all of those things. And then I think the other piece of it too is like understanding how to be like an active listener and to ask questions that actually help like the person communicate better with you, because I've had so many doctors where it's like all on me to communicate everything, and like I'm also dealing with brain fog. So it's like you're asking me, like even if I write it down, like you're like asking me to communicate clearly about symptoms when I'm like, what day is it? Like what's happening? Like I'm already kind of confused as it is, and then I'm trying to clearly communicate to you like, oh, I'm having these symptoms and I've been having it for X amount of time, and it's like so many symptoms, I'm overwhelmed. And also just like as someone who doesn't talk about pain, it feels weird to me to talk about pain, and so I'm always going to downplay it. Also, like my idea of pain is going to be so different. I've also had really incredible like experiences with women of color doctors, in particular that dermatologist who diagnosed me for the first time, who was amazing and like immediately understood and immediately was like the first to tell me like, yeah, like we need more textbooks that show what this looks like on Black skin. And so I do feel like it can be like this really amazing, like empowering interaction. And I think I think Rena and Nisha have both said it, but like those cultural understandings and like trauma-informed responses in the doctor's office is like so crucial.
I accompany my also multiply disabled partner to their appointments, and we're both autistic, and the doctor goes really, really fast, just really, really fast. And I'm managing my stress, my autoimmune condition, my behaviors so that I don't seem like a threat. I'm modulating my tone so that you don't think I'm seeking drugs. But if you are a person who thinks of yourself as being safe for people to talk to, slow down. Just slow down. If you do nothing else, I know you have 15 minutes for this appointment. And if it means that I need to have another appointment later on, that might be the thing to do. And that's not a failure of the first appointment, that there is more to talk about. Just slow down.
My roomie is also a person of colour. She's of South Asian heritage, and similar with Nicole, I thought I would have, had that mutual understanding too. But unfortunately, I've just been. I felt like I was an inconvenience last time I saw her, because I had to chase up my room. I had to call up the department. No one's answering, and it took months just to even get a phone call back. And then when I was finally seen by her, I just felt as if I was an inconvenience, because she was like, didn't even ask me how I was or like how long it's been.
It was really great to have a doctor who was another woman of color, because she really took the time to sit down and talk to me. And I felt like, she had a lot of, the same experiences as I did, which is really funny because, you don't see a lot of women of color talking about psoriasis. She asked a lot of questions, and she gave me a pamphlet, which was one of because she could tell that I was kind of like a deer in the headlights. That's a lot to take in, and she was very empathetic, and she was like, I have this pamphlet, and here you can take this home with you and look it over, and we can talk about it the next time.